Welcome back. It is time for Better Health with Dr. John Liprie. He joins us live in studio this morning. Good morning, sir.
Good morning.
You know, this topic, I tell you what, producer Lauren asked me this morning, Alex, when you lived in Ohio, did you have like mosquito trucks that would come by and spray? I said, I have never heard of a mosquito truck in my life until I moved here.
If you're going to live in the South in the summer, you're going to have mosquitoes.
Very much so. So that's kind of what we're talking about today. Topic of discussion, mosquitoes and the illness that can come along with them, correct?
Absolutely. So West Nile's in the news right now. We just did a little story where they've isolated the virus, the West Nile virus, in mosquitoes in Iberia Parish.
Right. Yes. So we did hear a little bit about that. Shall we talk about some examples of the virus?
Oh, yeah.
Jump right in?
We'll jump right in. One of the most common questions I get is, how concerned should I be? And really, it's okay. Only about 20% of those infected even have symptoms.
Oh, wow.
So about 80% are running around with a little low-level infection of some sort, but don't even know they have it.
Interesting.
And infection is probably fairly rare, but we have isolated the virus around these parts.
Well, that's good. That is good to know. Yes, I mean, because in other parts, not so lucky. Let's talk about, like you said,
Some
the
of
infection.
symptoms.
Yeah, symptoms, stuff like that.
Yeah, it's one of the things I wanted to add to the package is what do we mean by meningitis or encephalitis, right? We throw these terms around, you'll hear this.
Right.
So again, about 20% of the folks are infected and they'll have this flu-like feeling. They just feel bad. They'll have a headache, nausea, sometimes a little rash. That's kind of rare.
Right.
Then a small subset of those go on to have the bad stuff. And that's an infection around the lining of the brain, the lining is called the meninges. And so this is meningitis. And that's
Which makes
serious.
so much sense. Right.
Oh, yeah.
Super serious. Okay.
And then, oh yeah. And then a small subset of those, it goes on to infect the brain itself. And that's encephalitis. Those are the ones we have a hard time with in the hospital. They'll be in there a while. And they'll be in the ICU. They can be pretty sick.
There's two types of meningitis, though, right? Like the viral and the bacterial. Okay.
Oh, absolutely.
But this would be more so.
This is viral.
Okay.
So viral meningitis tends to be a lot safer. Bacterial is the one that is really, really dangerous.
Okay.
And a great topic for another discussion.
It most certainly is. We will maybe talk about that in the future, but when we come back, we're going to talk more about mosquitoes and the illnesses there. So stay with us for more.